And welcome back to Talk of Alabama. Well, we all know a good night's sleep is so important to our health, but millions of Americans struggle every night due to a breathing issue known as sleep apnea. Dr. James Sanderson joins us today with more, along with some new treatment options. Welcome to you.
Well, thank you for having me.
Well, this is exciting because it doesn't matter your age. Young people snore, old people snore, and it seems millions of people complain about waking up in the morning and still feeling tired.
Being exhausted when they get up in the morning.
That's the worst feeling ever.
It is.
So what do you do to help this?
Well, last January I found out that there was a device that I could get that would allow me to do a sleep study in somebody's bed, their own bed.
Okay.
And work with the physicians here in town, and we have a dental device that instead of the CPAP, which most people don't want to use when they have it, or at least half the people that have a CPAP don't like to use it.
Now, the CPAP, is that the thing that's on the table in the
That's
forefront?
on the table, and with all the hoses and all the fun things to lay down and go to sleep.
And that would be something that you have essentially bedside. You hook up to your face, put it over your mouth at night.
Right.
And then you keep that in and sleep with it all night. And it sounds like a pumping machine, doesn't it?
It does, and you know, but it creates positive air and lets you breathe during the night.
Okay.
And it's the gold standard.
It's not very romantic.
No, it's not
I would
very
say
romantic.
if you turned over to see that, you'd be like, So, okay, that's one option. That's been around for a long time.
It has, and it works.
And it does work. Okay, and men, women, does it matter what age you are to use this?
It doesn't matter. It doesn't matter on age at all.
Okay, now look at this new thing. Let me move this iPad out of the way. So this looks like a retainer of sorts.
It is, and it's a mouthpiece that you wear on your bottom teeth and your top teeth, and it brings your bottom jaw forward. Okay. And it will, in many, many instances, stop sleep apnea.
So what are these little things? Is this what's monitoring it? These little devices on the side? What is that?
It just fits together so that it keeps the bottom jaw from going back at all. And so by keeping the bottom jaw from going backwards and keeping it forward, it opens your airway.
And how cute they make them in pink.
That's right.
Mean, not that you're necessarily trying to be sexy at night, but I mean, that's kind of cute, actually. And you just put it in when you go to bed, and then you take it out when you wake up in the morning.
Take it out when you wake up in the morning.
Do people have any issues with something in their mouth? Is it heavy? Does it feel like there's something intrusive?
This is the first one that I found. Over the years, I've made some. I've not been really very successful with this up until now. But with this is comfortable to wear. It's not too big, too bulky. And it's been a real positive result.
And then what is this other thing you have?
This is a watch pad. It's the device that you can use that I can send home with a patient that will give me back a sleep study that will tell me whether or not the SomnoMed was successful or not.
Oh, so you can actually see when they're sleeping and if they're being woken up.
Correct, and it'll tell you how long they've slept. It'll tell you what position they were in. It'll tell you whether or not they had any apnea or not. Yeah.
Well, and they've had all kinds of studies that says, you know, sleep deprivation leads to weight gain, depression, so many other issues. So
absolutely, heart problems. People with diabetes have a 70% chance of having sleep apnea as well.
Really? Okay. So if somebody wants to come in and can you try one of these out on them to see what works best, or are they fitted, or how does that work?
What we do is we need a sleep study. Okay. And whether or not we use this to get the sleep study or we use the in-lab study, that depends on the patient and what's going on. Okay. And we have a consultation with the patient. We look at their medical history. We communicate with the sleep physicians, and then determine the best course of action for each patient.
Very nice. Well, I used to snore, and when I was around 28, I had my tonsils taken out, and for whatever reason, I stopped snoring.
That's because the airway was open.
Is that what it is?
Yes.
Okay. Well, thank God, because I would wake myself up. I would be so loud, and that's horrible. When you wake yourself up, and you're like, oh, well, that was me that was snoring. You know. Okay. So, doctor, how do people get in contact with you?
The office is 205-979-6005. Okay. And the website is SanDentistry.com, www.SanDentistry.com.
Okay, Dr. James Sanderson, thank you so much for your time.
thank you for having us.
And thanks for helping us all sleep a little bit better. Okay, still to come on Talk of Alabama.